Well, good morning, you guys. I'm so glad that you could be with us and watching this video. Today we have Miss Coley. She is a licensed clinical social worker with UTRGV. She's in School of Medicine, instructor of medicine, and she is with us through our connections with T-Chat. And so she's going to talk to us today about post-traumatic stress disorder and trauma and what it looks like and how to help your child.
Okay, well, thank you, Dr. Fowler, for that introduction. Today I will be talking to you about post-traumatic stress disorder and trauma. Just a little bit about what we'll be covering during this presentation. We will define PTSD and trauma. We'll look at the causes and types of trauma, talk a little bit about some of the symptoms of PTSD, treatment options, and some challenges possibly in treatment and prevention and coping strategies. So let's start out with talking about PTSD. Now, post-traumatic stress disorder, or PTSD, is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. An individual may experience this as emotionally or physically harmful or life-threatening, and it may affect their mental, physical, social, and/or spiritual well-being. Examples of this includes natural disasters, serious accidents, terrorist acts, war, combat, rape or sexual assault, some type of historical trauma, and intimate partner violence and bullying. Now, trauma is the emotional response that a person has to a terrible event like an accident, crime, natural disaster, physical or emotional abuse, neglect, experiencing or witnessing violence, death of a loved one, war, and more. Immediately after the event, shock and denial are typical. Longer term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headache or nausea. So, understanding PTSD and trauma is important because it helps us to recognize and helps us support our loved ones, communities, and students who may be experiencing symptoms. Furthermore, knowledge about PTSD and trauma enables school personnel and parents to create a safe and supportive environment where students or their child feels understood, accepted, um, reducing the risk of stigma and isolation. And this understanding also helps facilitate collaboration with families and mental health professionals to develop comprehensive support plans that address the unique needs of students and families with PTSD and trauma. So I just want to start out by going over the different types of trauma. Trauma can be caused, again, by a wide range of events and experiences that overwhelm an individual's ability to cope and have lasting psychological effects. Trauma can be categorized into several types based on the nature of the events and experiences that caused it. So there's acute trauma. An acute trauma results from a single highly stressful event or series of events that overwhelm an individual's ability to cope effectively in that moment. Examples include accidents, natural disasters, physical assaults, or witnessing a violent incident. Acute trauma often leads to immediate emotional and physical responses, such as shock, fear, and distress. It can trigger symptoms of PTSD, post traumatic stress disorder, and require immediate support and intervention to help individuals process and recover from the event. Chronic trauma, also known as complex trauma, stems from prolonged exposure to traumatic events or stressful circumstances that occur repeatedly over an extended period. This type of trauma is often associated with experience such as ongoing physical or sexual abuse, neglect, domestic violence, or living in a war-torn or unstable environment. Chronic trauma can significantly impact a person's sense of safety, self-worth, and ability to form healthy relationships. It may lead to complex PTSD or other mental health disorders requiring a comprehensive and long-term therapeutic approach and interventions. Next on the list is complex trauma. And let me go back to say a little bit about chronic trauma. Chronic trauma impacts on an individual's sense of safety. Individuals who have experienced chronic trauma often develop a pervasive sense of insecurity and danger. Their nervous systems may remain in a heightened state of alertness, anticipating threats even in a safe environment. And this hypervigilance can be exhausting and make it difficult for them to relax or trust others. Chronic trauma also has impact on a person's self-worth. It can erode a person's self-esteem and sense of self-worth. Cons- um, Constant exposure to negative experiences and messages may lead them to internalize feelings of shame, guilt, or worthlessness. They may come to believe that they are inherently flawed or undeserving of love and respect. Forming and maintaining healthy relationships requires trust, communication, and emotional intimacy. And chronic trauma can disrupt these abilities in several ways. Trauma survivors may struggle to trust others due to past betrayals or abuse. They may fear being vulnerable or opening up to others. Trauma can impair communication skills, making it hard for individuals to express their needs, emotions, or boundaries clearly. And some trauma survivors may develop insecure attachment styles, such as avoidant or anxious attachment, which can complicate their relationships. Now, complex trauma refers to exposure to multiple traumatic events, often of an interpersonal nature, occurring over an extended period and typically during critical developmental stages. It could involve childhood abuse or neglect, domestic violence, human trafficking, or prolonged exposure to war or conflict. And complex trauma can result in severe and pervasive psychological, emotional, and social impairments, affecting various aspects of an individual's functioning and development. Treatment for complex trauma often involves addressing multiple layers of trauma and may require specialized therapeutic approaches, such as trauma-focused therapies, therapies such as cognitive behavioral therapy, EMDR, which is eye movement desensitization and reprocessing, and didactical behavior therapy can help individuals process traumatic memories, manage symptoms, and develop coping strategies. Secondary trauma, also known as vicarious trauma or compassion fatigue, occurs when individuals are exposed to the trauma experiences of others, such as healthcare providers, first responders, therapists, and or caregivers. This type of trauma can result from continuous exposure to others' traumatic stories or experiences, leading to emotional distress, fatigue, and burnt out. So, underlying these types of trauma or understanding these types of trauma is essential for identifying and responding to the diverse needs of trauma survivors effectively. It underscores the importance of trauma-informed care and interventions that consider the specific nature and impact of each type of trauma on individual lives and well-being. And trauma can manifest in various forms, each with its own profound impact on an individual's physical, emotional, and psychological well-being. So now, let's move on to symptoms of PTSD. So PTSD, post-traumatic stress disorder, shows through a range of symptoms that can deeply affect an individual's daily life and well-being. Common symptoms include intrusive memories or flashbacks of the traumatic event, where individuals relative or relive the experience vividly and controllably. Avoidance behaviors may develop as a way to sidestep reminders of the trauma, leading to withdrawal from people, places, or activities associated with that event. Hyperarousal symptoms, such as heightened vigilance, irritability, and difficulty sleeping or concentrating, are also prevalent, often contributing to a sense of constant unease or danger. Negative changes in mood and cognition may occur, including persistent negative beliefs or feelings, detachment from others, and a diminished interest in activities once enjoyed. And these symptoms can vary in intensity and duration, impacting relationships, work, and overall quality of life. Effective treatment typically involves therapy, medication, or a combination of both to help individuals manage and alleviate PTSD symptoms effectively. Diagnosing and assessing PTSD involves a comprehensive evaluation by mental health professionals to determine if an individual meets the criteria outlined in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Health Disorders that mental health professionals use to help diagnose. Clinicians typically conduct structured interviews and assessments to gather information about the individual's trauma history, symptoms, and their impact on daily life. Diagnosis requires the presence of specific criteria, including exposure to a traumatic event, re-experiencing symptoms such as flashbacks or nightmares, avoidance behaviors, negative changes in mood and cognition, and hyperarousal symptoms. Assessment may also include psychological tests, self-report questionnaires, and collateral information from family members or other sources to gain a comprehensive understanding of the individual's experience and functioning. It is critical for a clinician to consider the cultural factors, individual differences, and the context of the trauma in making an accurate diagnosis and developing a personalized treatment plan that addresses the unique needs of each person experiencing post-traumatic stress disorder. So I want to talk to you a little bit about prevention and coping strategies in treating PTSD. And these strategies encompass a range of approaches aimed at reducing the risk of developing PTSD after trauma exposure and helping individuals manage symptoms effectively. So, the first is early intervention. Early intervention, early identification and intervention following trauma exposure can mitigate the development of PTSD. Immediate support, such as psychological first aid and crisis counseling, helps individuals process their experience and emotions early on, potentially preventing the onset of more severe symptoms. Education and awareness, educating individuals and families about PTSD is its symptoms and available resources can promote early recognition and help seeking behavior. Increasing awareness reduces stigma and encourages open discussions about trauma, fostering a supportive environment for those affected. Um, some other strategies are, as I mentioned before, trauma-focused therapies. Evidence-based therapies such as cognitive behavioral therapy, CBT, particularly trauma-focused CBT and EMDR are effective in treating post-traumatic stress disorder. And these therapies help individuals confront and process traumatic memories, change negative thought patterns, and develop effective coping skills. Medications, antidepressants are commonly prescribed to alleviate symptoms of PTSD, such as depression, anxiety, and sleep disturbances. Medication can be used in conjunction with therapy to enhance treatment outcomes, along with a supportive family and support system. Mindfulness and stress management techniques like mindfulness, meditation, yoga, deep breathing exercises, and progressive muscle relaxation can help individuals manage stress, help them regulate emotions, and improve their overall well being. And these practices promote relaxation and reduce the hyperarousal symptoms associated with PTSD. Social supports and peer networks. Building and maintaining strong social support networks can help buffer against the effects of trauma and PTSD. Peer support groups provide opportunities for individuals to connect with others who have experienced similar challenges, share coping strategies, and receive validation and encouragement. And healthy lifestyle choices, engaging in regular physical activity, maintaining a balanced diet, getting adequate sleep, and avoiding substance use can support overall mental and physical health. And these lifestyle choices promote resilience and enhance the body's ability to be able to cope with different stressors that may come up. So, treating post-traumatic stress disorder and trauma poses several challenges due to the complex nature of the disorder. The heterogeneity of trauma experiences. Trauma can arise from various sources. Again, it can arise from interpersonal violence, accidents, or natural disasters, and each individual's experience of trauma is unique, influencing the severity and the type of symptoms they present, which complicates the treatment approach. Comorbidity and other disorders. PTSD often occurs with other mental health conditions such as depression, anxiety disorder, substance use disorders, or physical health issues. And addressing these comorbidities concurrently can be challenging, but is essential for a comprehensive approach to treating PTSD and trauma. The delayed onset of symptoms of PTSD may not appear immediately after the traumatic event, but can develop months or even years after. And this delay can hinder early intervention efforts and prolong suffering before a diagnosis and treatment are initiated. Avoidance behaviors. Many individuals with PTSD engage in avoidant behaviors to kind of erase or avoid reminders of the trauma, which can interfere with their willingness to participate in therapy or to even share about their experience or adhere to treatment recommendations. The stigma and barriers to treatment, misconceptions about mental health and PTSD can create stigma, causing individuals to delay seeking help or avoid treatment altogether. Additionally, logistical barriers such as limited access to mental health services, financial constraints, and different cultural factors may further hinder treatment engagement. And, also there is treatment resistance and dropout. Some individuals may experience resistance to treatment due to distrust, fear, or revisiting the traumatic or reliving the traumatic memories or perceived negative experiences with therapy that they may have, had. High dropout rates from treatment programs can compromise the effectiveness of interventions. Again, the complexity of trauma processing. Processing and integrating traumatic memories and emotions can be emotionally intense and challenging. Um, Addressing these challenges requires a multifaceted approach that includes tailored interventions to the individual experiencing PTSD and trauma, uh, patient and parent education, collaborating with support networks, and ongoing assessment and an adjustment of treatment strategies, enhancing public awareness, reducing stigma, and improving access to trauma-informed care are some of the critical steps in supporting individuals affected by PTSD and trauma on their road to recovery. So, now after hearing about, PTSD and trauma, how can you help? So, supporting individuals with PTSD as a parent or a teacher involves creating a safe and understanding environment. And, I'm just going to discuss some approaches that can be taken. One is to educate yourself, understand the symptoms and triggers of PTSD, and this helps in recognizing signs of distress and responding appropriately for our loved ones and students. Creating a safe environment, foster, a classroom or a home atmosphere or environment that promotes safety and predictability. Clear routines and consistency with expectations can help reduce anxiety. Be flexible. Be understanding of potential challenges, such as difficulty with concentrating or sudden emotional responses that we may see in our students or our child. Offer flexibility with deadlines, household chores or assignments when needed. You want to respect triggers, be aware of the potential triggers, such as loud noises or if certain topics come up, and try to accommodate the sensitivities when possible. For instance, allowing breaks, allowing your child to take a time out if they need it from a certain situation or conversation or topic, or giving an alternative for teachers' assignment if a topic is too triggering. You want to listen and validate. If a child discloses their trauma or PTSD, you want to listen without judgment. You want to validate their feelings and let them know that it's okay to feel the way that they do. Um, Seek out and offer supportive referrals. Connect the child with school counselors, psychologists, or support services if they need additional help beyond what it is that you can provide. Um, again, provide predictability. Give advance notice of changes whenever possible. Unexpected changes in schedule or routine can be distressing for a child or any individual with PTSD. You also want to encourage self-care, teaching stress management techniques or mindfulness exercises that can help students and your child manage their symptoms. It can be meditation, breathing exercises, different type of grounding techniques. Be patient. Recovery from trauma and PTSD can be a long process. Be patient and understanding of setbacks and some difficulties that may arise. You always want to maintain the person's confidentiality. respect the students or the child's privacy regarding their trauma experience, and only share information on a need to know basis with their consent. you know, Advocacy is always important. So you want to advocate for accommodations, whether it's, working with your child's school administrators to ensure that appropriate accommodations are in place, such as extra time on tests or preferential seating. Um, and, again, just promoting a positive peer environment. Foster a classroom or home environment or a culture of empathy and respect. You want to educate other students and other individuals about PTSD to reduce stigma and encourage support. And by implementing these strategies, we can create a supportive and inclusive environment where students and children and any individual with PTSD feels understood and can thrive, both academically, emotionally, physically, and mentally. So, these are just some of the references that I used in putting together this presentation on PTSD and trauma for you this morning. And, I want to end by, saying thank you for joining me this morning for this presentation and allowing me to talk to you a little bit about PTSD and trauma. And at this time, I will open it up for any questions, any comments, or feedback. And thanks again.